know that the first HIV/AIDS cases were detected in the United States in early 1980s, in fact in 1981. HIV was first detected in India in 1986. In 1986 we had 2 cases, and today we are told that we have something like 5.13 million people living with HIV. That is the largest number of people living with HIV after South Africa. We as professional social workers, both educators and practitioners, have a major role to play in creating awareness and in educating people about the what, why and how of HIV, and help our community to have a better day tomorrow. Social workers are the best people who can make their interventions meaningfully and effectively. All of us work, and all of us know that social workers work practically under every sector under the sun. We do work with the families, with the individuals, with the groups. We do work with the corporate sector, with the education institutions, with the correctional institutions, with the rural urban setup, in the tribal communities, vulnerable population, name anything, and we are there to help them. And therefore, it is necessary that we provide accurate and complete information to our people. As most of you know, the BSW program that the university IGNOU is offering has compulsory courses on HIV/AIDS, on family life education, which is very much related to HIV/AIDS related issues, as well as on substance abuse, including counseling and communication. I have few questions to the people in the dais. To my right is Dr. Jyoti Kakkar, who is an associate professor of social work in the Department of Social Work at Jamia Millia Islamia here in Delhi. To her right is Dr. Chingulal Tansing. He is the Asia Pacific Chief of the AIDS Health Foundation Global Immunity, which is located here in New Delhi. Both of them have extensive experience, one as a professional social worker, the other as a clinical practitioner, particularly dealing with HIV/AIDS for last more than 10 years. And to begin with, I would request Dr. Tansing to tell us about the actual situation of HIV/AIDS in this country. Dr. Tansing.
Yeah, thank you very much, Professor Gresses. As you had just shared, the first HIV case was detected in India in 1986. Probably though the infection must have started way in the early part of 80s or later part of 70s. And definitely the situation in India is really gaining such a stage that it's really the magnitude has really gone way overhead, and from a single case in 1986 to over 5.1 million is really a very big number. And also, as you see in India, our population is so huge that though right now the rate of infection is at about 0.9%, that it has reached that a state already. So I think in terms of the sheer population and the magnitude, I think definitely it's really becoming such a big problem, moving from moving from the urban areas to the rural areas, and also from the the high risk group to the low risk group. Definitely we have a big problem, and working around the country in various states in care and support for HIV positive people, we are seeing more and more number of people coming in for treatment and coming into access care. I think definitely we have got a big problem, and there's a lot to be done, and definitely there's a lot can be done if we are to kind of slow down the process, not to talk of even to halt the process, but to slow down the process we really need to really continue every single day on a war footing to stop to prevent and also treat and provide care and treatment for these people who are positive in the country.
We are living with HIV for over 2 decades now in India. Much work has gone towards the prevention and control of this particular epidemic. Every sector has been activated. Much work has gone into at the district level and the taluk level, and even panchayats have been motivated to intervene in this particular area to address the issues which are very sensitive. This particular disease has much to do with personal behaviors, and in the context of our own lives in the Indian subcontinent, culture and the social norms have much to do with that. And as a professional social worker and educator, I would request Dr. Jyoti Kakkar to enlighten our views about the implications of cultural factors as far as the prevention and control of HIV/AIDS is concerned in the Indian context. Dr. Jyoti.
Thank you, Professor Thomas. Talking about India as a country which is probably standing second in terms of numbers of the HIV infected, we as social scientists need to really go into the cultural context of the problem, and we know that ours is a culturally diverse country. We have so many subcultures prevailing. So what are those factors which are making the spread of this disease interlinked with the cultural context? I think first and foremost I would like to talk about poverty. At the base of all this is poverty, which is marginalizing some populations by themselves, and connected to this is the illiteracy. We all know that we have taken so many initiatives in the last 2 decades towards generating awareness, information, education and communication. So we have time and again stressed on the importance of awareness. But once you give awareness to the people, you are using different kinds of media. The media which is verbal, non-verbal, folk media, so many other things need to be used to reach to the people who are not literate and for whom the media is not even easily available. So one should never sit here in the capital and think of the country from this angle, this perspective. We have to reach out to the rural populations and our masses. So illiteracy and ignorance, awareness and knowledge all have to be demarcated very clearly. The third point I would feel is the socialization of the child in our country, where the family is very much concerned, bringing up the girl child, parenting of the son. These two aspects, they are so different that it leads to a certain position, the status of women which we have in our country. And what are the implications of these for HIV/AIDS? I would briefly elaborate. The women in our country, for example, would find it very difficult to access the healthcare system. They would probably resort more to the use of home remedies, what we call gharelu nuske, and they would be the last ones to get their, for example, STIs treated at a local PHC or even any kind of a healthcare system. When this woman is at home and she is suffering silently, she is more vulnerable to other kind of related health problems and diseases too. Next is the issue of learning about sex. If we look at the adolescent and the youth population, where do we pick up our knowledge about sex and sexuality? You must have heard so many, you must have heard and read about so much of the press coverage regarding whether sex education should be imparted by the school teachers or not. Should school be a forum? Should we call consultants in? I have done research in this on my own. I have found that there is so much resistance among the teachers to be the agents of this kind of change. So learning and talking about sex is taboo in so many of our cultures. And lastly, the kind of society we have, time and again we have seen related to so many other illnesses, there is stigma and discrimination. Talk about leprosy, talk about TB, and now stigma and discrimination in relation to HIV/AIDS. So a culture is perpetuating and marginalizing those who are suffering. So integration of all these groups is of prime importance. I think first, as social workers, we need to understand all the dynamics which go into creating this context.
Thank you, Dr. Jyoti. Now to move further, as Dr. Jyoti said, so much of work has gone into it. There is a particular role to be played by the professional social workers in mitigating this particular problem. One of the major hurdles that we face is the misconception about HIV/AIDS and the related issues. And being an expert who had been working in the field of HIV/AIDS for over a decade, I would request Dr. Tan Singh to kindly enlighten us the kind of hurdles that we face, the kind of misconceptions that are around, and how to come over this kind of a problem so that people can respond positively to this particular problem or epidemic. Dr. Tan Singh.
Thank you very much. You know, ever since we heard about the HIV and AIDS epidemic, and also like in our country for over the last 15 years, one of our main thrusts is definitely awareness, and also mainly on the information, education and communication. And then that's one of the major tasks of the national government task. And interestingly, till today, including people who are supposed to be the professionals or in the healthcare settings, and also people from the counselors, still has no definite clarity. That is one thing that's extremely surprising and actually beating us at the good work which has been done. I think it's very important for all people involved in the healthcare, whether it's in the healthcare or whether people in the social work, to be really clear, extremely clear of the four main routes of transmission. That is through the having a sexual intercourse with an infected person without protection, or whether it's through blood transfusion, through sharing of infected needles among injecting drug users, or and fourthly through mother to child transmission. I think what is really important is to be extremely clear on these four issues and really not bother about the others. I think we don't have to really bother about the others. Of course, when you talk in terms of HIV transmission through through secretions of body fluids, definitely the blood, the semen, the vaginal secretions, those has got the highest concentration of the virus. Other secretion, like whether it's the tears, whether it's urine, whether it's the sweat, everything does have the virus, but they don't have enough to cause a problem to transmit it. So therefore such things like shaking hands, sitting down together, drinking from the same glass, eating together, or sharing the toilet, or hugging, I think, or mosquito bites, those things never ever, there has never been any record of HIV virus being transmitted. I think we really got to concentrate on how it spread, and then really, we really got to break this myth. So many of the myths. Oh, it could have been. Oh, the barber, the shaving blades. A lot of things are there. I think, and it's still going on, and it will still continue to go on. All these myths. I think the main thing definitely is clarity and understanding of the four major routes of transmission, and just sticking to that one, and just saying, hey, nothing else really does. I think that's really important.
Thank you, Dr. Tan Singh. When we are talking about breaking our head to find ways and means of preventing HIV/AIDS, we are talking in the Indian context. We are addressing a problem that is facing over 1,200 million people residing in this country. That's a huge number. Now, if you look at the number of schools that we have across the country, take for example the whole of Northeast, including Sikkim, 8 states, and simply only 2 departments of social work, and they may be hardly training about 15 to 20 students. Definitely with that kind of a smaller number, it's a huge challenge to address this huge problem which is facing everyone, from the newborn child or the child in the womb to an aged man who is nearing his last days. It's a huge challenge. Now, initially these cases, when it was detected, especially in the US, these were all found among the homosexuals. So people thought perhaps this is a disease prevalent only among the homosexuals. Later they found that the disease is also spreading among sex workers, which also means among women. And so they found that HIV has crossed all borders. There is no discrimination because of age, sex, profession, marital status, socioeconomic status, nothing. Everyone is at risk of HIV. Now, in the Indian context, the initial cases were detected among the sex workers. Even the present data shows that after 20 years of analysis, about 28 to 30% of the infected are found to be among the women. And there is a kind of shift in the trends as far as the spread of the epidemic is concerned, and new terminologies are also coming in, especially on feminization of this particular pandemic. And Jyoti Kakkar, who is an eminent expert on this particular topic, will definitely educate us on this shifting trend. Dr. Jyoti.
Professor Thomas, you have so rightly said that there was a time when we used to think there are certain at-risk groups, the commercial sex workers, the injectable drug users, the men who have sex with the men or the MSMs, the migrant laborers, and we used to think it is a pandemic which is restricted, but the HIV virus has proved that it is not selective. It is not selective to people by their occupation. The virus has moved across the bridge populations to the masses, and I think all of us now are at risk. There are no risk groups as such, and I think that terminology already has been considered to be quite obsolete, because every person, we have so much of the antenatal clinic attendees already reporting of being HIV positive, though I must add that handling HIV at that level is very easy. When a woman is about to give birth to a child, she can be treated very fast for this, so the child can be in all possibilities protected from having HIV further. Now when we are talking about the HIV and its trend movement from the at-risk groups to the general population, women have emerged as a larger group of being infected, touching about 38 to 40% in most of the countries, which is a remarkably large percentage. Now why this, and I think one can illustrate this best with an example. Now they are being called innocent partners, the silent sufferers of this epidemic. Why the silent sufferer? I met a worker, in an industrial setting, who said that when he moved to Delhi for employment, he would save every penny and send it to his village, to his family. Gradually he stopped going. He could not save money enough to buy his ticket, and he would just money order. After a year and a half, he reached a situation where he was so depressed, he started having alcohol, sitting with people after his work hours, and he says, I didn't even realize that when from alcoholism I moved into promiscuity, and today I am running 2 homes. I have one wife in the village and I have one wife in my slum near the factory. So see how this transition occurs. Secondly, women are more vulnerable because of the physiological factors. Biological vulnerability has been proved to be much higher among women for the transference of the virus during sexual intercourse. So that is becoming a second reason. So now very often you see so much of the literature, the media saying that she is the innocent sufferer. It is not the commercial sex worker, it is not those who are promised, it is the innocent wife at home who may be having a spouse who is traveling frequently and carrying back the virus home.
Well, we have many issues to be discussed, and while we are deliberating on these issues, people in the audience are free to make your interventions. If you have any questions for clarification or anything to be added, you are most welcome. For information of the audience, I would request Dr. Tansing to tell us if one has a fear whether one is infected or not, because all of us do get involved with situations of risk factors, like practically all of us do go to healthcare setup where one may have to take an injection or interact with the patients. So much of fear, so much of anxiety do exist among people, whether one should go for an HIV test. If so, where one will go, do they need to pay something, and issues associated with in case if one is infected, where he goes next, and in terms of revealing his or her own status to the near and dear ones, because most people go underground once they come to know that they are HIV positive because of fear and stigma. Dr. Tansing.
Thank you very much. I think this is really a very important issue. It was very difficult. It was very difficult in the earlier years, like in India, as we said, the epidemics here for the last 15 years. It was very difficult in the sense that there is a lot of ignorance about HIV, about how people get HIV, and then a lot of people do not know they were at risk because, as you said, lack of information. And also later on, when the general public or general population get to know more about HIV and then they definitely realize that, hey, I could be HIV infected. But the situation as such was extremely difficult because the infrastructure to kind of help them, like the absence of counselors, the absence of social workers, or the disinterest of the medical fraternity as such, because they couldn't. So people find it extremely difficult to even go for testing, and then also not just that, where are they going to be tested? There were not very many, but now, as you see, the National AIDS Control Program definitely has been really moving up the scale of setting up voluntary counseling and testing centers. So, and another thing really important is that if a person is HIV infected, whether through sexual route of transmission or through blood transfusion or maybe injecting drug use, nobody knows till many years down the line that they could be HIV infected. So you don't feel well, you're quite okay. It is really nobody know they're HIV infected unless they go in for testing. So there are a lot of people who have the phobia or the fear as to, if I go, what will happen to me? If I test positive, will my friends continue to love me? Will my family still accept me? Will I be thrown out from my job? Will my friends in school or my college will accept me? There's a lot of this fear going on, and a lot of times there are the people really suffered for many years till they finally overcome that fear and go in for testing to realize that they are never HIV positive.
Well, many of our viewers are professional social workers, and some of them are quite keen to know about the role of a professional social worker, whether as a teacher or as a practitioner in the area of HIV/AIDS, and I would request Dr. Jyoti to kindly enlighten us on this particular issue.
Professor Thomas, having nearly worked in this field for the last 15 years and also being a faculty member at the Department of Social Work, Jamia Millia Islamia, I feel that social workers have responded very well, and in the recent 5 to 10 years they have really picked up the issues which need to be addressed in the context of HIV/AIDS. All over the country we have so many non-governmental organizations, that is the voluntary sector, where social workers are employed and taking up the issues, counseling the HIV positive people and addressing this issue at the grassroots level with women through kirtan groups, through focus group discussions with the youth, with the adolescents, the NSS programs. Social workers are actively involved in all these programs, whether they are in the governmental or the non-governmental sector. Next, we have so many initiatives which are coming from social workers, such as the Cafe Dafe program under IGNOU, right? So we have this facility for so many people to acquaint and educate themselves and then further transmit the knowledge which they acquire in their own areas. Social workers have not left research also as an avenue. There's so much research, and many schools of social work have made HIV/AIDS research a priority area at the doctoral level. So they encourage that people take up research. And next, I would also like to talk about industry. We have so many social workers in the industrial setting who have accepted that there is an initiative by the International Labour Organization or the ILO and the Code of Conduct. And I have a very innovative example of one of my students in Delhi itself doing street play with his workers at the shop floor on HIV/AIDS. So he is developing with their talent within the group themselves. They are becoming peer educators and addressing this issue at the workplace. So that is so innovative and creative. It is not a one-time intervention. So a social worker, irrespective of the setting, community, industry, the medical setting, the school, the youth, in the university can address the issue of AIDS in multiple ways, and we find them all over doing it. And lately, with the VCTCs being coming up everywhere, we have posts of counselors for the social workers, professional social workers who are postgraduates. They can find employment in the VCTC. The VCTCs are an initiative by the government, that's the voluntary counseling and testing centers, which are coming up all over the country, and the initiative has been taken primarily to outreach all populations who we don't want people to marginalize or go underground if they have a fear. So VCTC is an open area where you can enter and get yourself tested, and now the current approach is that they are giving VCTCs to universities also. So under the NSS coordination with NACO, VCTCs are being opened in every universities. So that is so much access to the students, So now the social worker has a very important role to play in getting the student to know about it, getting him there, doing the pre and the post-test counseling. So a lot of work needs to be initiated in that direction. Looking into this, there's so much which social workers can do, because this is one disease which needs both clinical management and it needs the psychological support also. So counseling is a very important parameter in this, and it is very much available, and some non-governmental organizations are doing excellent work in this. And lately the approach has been the JIPA approach, greater involvement of people with AIDS. So people who are suffering from AIDS don't need to suffer silently anymore. I think there are so many initiatives being taken by those who are already infected. I must give an example here again, of a woman who's a medical professional and undergoes HIV testing time and time again. Every 4 months she comes to a path lab, gets herself tested, and she is positive. So the counselor there asked her that, why do you do this? She says, I like to monitor my status. See, the denial that maybe one day I would test negative. There's a denial, and there's a very difficult period of accepting the report. So definitely one can help by guiding such people to the right kind of counseling centers, getting them treatment available, making them understand that this is not the end of the world.
My question is to Dr. Jyotika. This is in the context of the women becoming the silent sufferers in the case of HIV AIDS pandemic because of the cultural disadvantage of the women in our nation, and also because of women becoming like passive partners in sexual activity. Don't you think there is a need for a kind of clear separate set of strategies on the part of social workers to address the issue of women getting affected by HIV AIDS? Don't you think that we need to already collaborate with the SHGs, and especially when it comes to the case of kind of safe and assertive sexual negotiation, and in this context, don't you think a separate set of strategies are important?
You're very right in saying this, that a separate set of strategies is needed, and I think already work is being done in this regard. Strategies separate, addressing the gender issue vis-a-vis HIV AIDS are already in the pipeline, even where the government is concerned, So all these initiatives, by opening women study centers at the university level, by developing policy perspectives, health perspectives with a special focus on women, are already very much there.
Voluntary confidential counseling and testing centers. Can you have some light on this, why it is confidential, and how we are going to help the affected person or even not affected persons keeping the confidentiality intact?
Confidentiality is definitely very important. As you know, in the early years of HIV/AIDS here in India, we had a very high-profile case about where Apollo Hospital in Chennai had breach of confidentiality, where a person who donated blood was informed about his status to his fiancée or relatives before being informed to him. He in fact doesn't know that he was HIV positive because the hospital never told him, but they broke that confidentiality, causing a ripple of effect, in terms of like breakup of family, being thrown out from the community, have to go out from this thing. So definitely the confidentiality part is really important.
Thank you, Dr. Tan Singh, as well as Dr. Jyotika. Thank you for your participation.